Hello, everyone. How are we this morning? Thank you for the introduction. It's truly an honor to be here in this very room where I think we all felt the privilege and the weight of our calling. I remember the early days of medical training, the long hours, the steep learning curve, the constant balancing act of academics, electives, research, and service. The reality is, most of us went into medicine not for the title or the accolades, but we entered because we wanted to make a difference, to help people, and to have a positive impact on patients' lives. Each of us began this journey with a sense of purpose, a desire to help, and a belief that we can make a difference. And that spark still lives in all of us today. Sometimes that purpose evolves, sometimes it leads us to unexpected places. And for me, that path went to internal medicine, followed by palliative medicine and hospice, with a large majority of my time spent in intensive care. During my residency in the US, I spent a significant amount of time in the ICU, and I witnessed the remarkable capabilities of modern medicine to sustain life in critical moments. Yet, amidst the high intensity interventions, I began to notice a deeper concern. While we were so focused on saving lives, we weren't really asking ourselves, what kind of life does this patient want to return to? And that experience really underscored for me the importance of supporting patients with complex illnesses in their own environments through holistic, patient-centered care that aligns with their values and goals. It also reinforced the urgent need to initiate goals of care conversations early before a medical crisis. When a medical crisis comes, it often limits that space for meaningful dialogue and shared decision-making. And one shocking statistic I came across is 60% of people with serious illness prefer home care, but less than 30% die at home. It shows a glaring gap where people with complex illnesses, they want to be at home, but the infrastructure is not there to support that wish. There's a significant gap of trained home healthcare providers who could ensure that patients have the right care at the right time. That realization changed everything for me. I began asking a new set of questions. How do we make it possible for someone to receive care at home surrounded by the people and the things that they love? And part of that questioning deepened as I took a more close look what was happening back home in my island of Trinidad and Tobago. The Caribbean, like many other countries, is aging rapidly. Across Latin America and the Caribbean, individuals aged 60 and over comprise 18% of the population in 2022, and that's projected to double to 25% by 2050. Countries like Trinidad and Tobago already have nearly 18% of their population over the age of 60. And this accelerating aging trajectory creates an urgent demand for tailored healthcare, long-term care solutions, and home-based services designed for older adults. In the Caribbean context, aging comes with unique challenges. The migration of younger generations, leaving many older adults without close family support. The prevalence of chronic diseases, economic pressures that limit our access to quality, consistent care. And culturally, we don't really talk about death or decline, and planning happens when it's way too late. So this journey led me into palliative care and then into designing healthcare systems, especially for aging communities, that center around what matters most. It's a model that doesn't just manage illness, it centers the patient. It makes room for families, for culture, for spirituality, for hard conversations. It's a model that could transform how we age and how we care for our most vulnerable and how we uphold dignity even when it's no longer possible. Palliative care isn't about easing the pain of those at the end of life. It's about delivering the right care in the right place at the right time. It empowers patients to make decisions that truly reflect their values and goals. The goal is to engage persons earlier and upstream, well before hospice, so we can improve that quality of life and create space for meaningful conversations when they matter most. And that's how LivHealth was born. I returned to Trinidad and Tobago to create a home healthcare model designed to meet those needs, especially geriatrics, palliative, and hospice. The aim wasn't just to provide a service, it was a shift in the way we think about healthcare and aging, and to ensure that patients had the choice to live and die on their own terms. As we rethink what specialized home healthcare can and should look like, it's clear that innovation isn't just an option, it's essential. Today, I invite you to think about yourselves as pioneers in this journey. Your purpose, your calling, doesn't end at the consultancy level. It extends beyond into the very systems that we're shaping. With that in mind, I'd like to share a brief video that highlights how we're addressing critical gaps in care, ensuring that individuals receive the support that they need in the comfort of their homes. Palliative care, a fundamental human right, as declared by the World Health Organization. In 2014, the World Health Assembly passed a resolution 67.19 titled Strengthening of Palliative Care as a Component of Comprehensive Care Throughout the Life Course, calling all nations to strengthen and integrate palliative care throughout their health systems and to ensure its availability. Yet Trinidad and Tobago, like many countries, lack a comprehensive palliative policy. Palliative care is not a listed subspecialty, and there currently exists no national plan to implement such. The Global Atlas for Palliative Care characterizes our provision as isolated and patchy, heavily reliant on donor funding and insufficient for our population size. Despite our minimal palliative infrastructure, what we do have is hope in a culture of community where neighbor helps neighbor and families go above and beyond for each other, complemented by groups of passionate advocates of the cause, including doctors, nurses, and established societies. Leveraging the pathway paved by those before us, LivHealth, a privately funded service, was established in 2020, recognizing the dire need for community and home-based palliative care. Fueled by our collective passion and culture of community, we crafted a multidisciplinary service encompassing medical, nursing, pharmacy, and supportive therapies. In 2022, we were awarded the Shaping the Future of Innovation grant funded by the EU and IDB, which played a crucial role in our expansion, allowing us to extend our reach from the northwest region of Trinidad to encompass the eastern corridor, central, and southern regions, ensuring that no patient is left behind. Our journey was paved with a number of obstacles. Scarce medication, challenging terrain, and security concerns pose significant challenges. To surmount these hurdles, LivHealth established its own pharmacy and devised innovative technological advancements and transportation strategies to reach even the most remote patients. Moreover, building a skilled workforce has been paramount. Through rigorous training and certification programs for doctors, nurses, caregivers, and staff, our team is now equipped with the tools required to provide high-quality 24/7 care. In 2024 alone, our efforts resulted in 1,452 hospital avoidances, underscoring the profound impact of our service. With an average of 240 visits per month, nearly 3,000 visits a year, every visit represents a moment where a patient was cared for, a crisis was prevented, and a family found hope. Today, 80% of our referrals are for palliative care, signaling a shift towards proactive care. To address the financial hardships faced by our patients with limited means, the NGO, the LivHealth Charitable Foundation, was founded. Its mission is to ensure all patients have access to home hospice care, regardless of financial ability. As proud Trinbagonians, we are committed to uplifting our aging community across every domain of care. Through our partnership with Living Waters Community, we oversee our hospice and nursing homes, along with free social work and emotional services, including grief counseling and dementia care. The REMED program furthers its mission by facilitating the donation and redistribution of essential medications at no cost to those in need. Over $450,000 worth of medications was donated in 2024 alone. But it wasn't always like this. Just 3 years ago, we lacked the infrastructure, partnerships, and reach that define our service today. We saw the need, we listened to our patients, and we took action, step by step, building a model of care centered on dignity, accessibility, and compassion. As we continue our journey, we remain committed to deepening our impact and expanding our support for those who need it most. This approach lays the foundation for a sustainable long-term system, one that can be replicated to meet the growing needs of the aging and medically complex populations, with plans to franchise the home healthcare model into the wider Caribbean region. Currently, and in progress, and in alignment with the shift in care delivery and the growing gaps of aging in place, LivHealth has recently been launched, which represents a key part of the long-term solution, a residential community living complex designed for both independent and assisted living, as well as skilled nursing home care. It's more than just housing. It's an initiative that preserves a senior's independence, fosters connection, and ensures that they could continue living meaningfully during the last season of their lives. So let me ask you this. Who here learned business in medical school? Most of us didn't. We were trained to diagnose, to treat, to care, but not to build or scale solutions within every system we work so hard to uphold. Yet every one of us has seen the gaps. You've thought, if only this existed. You've had the ideas, and what you may not realize is that's your launch pad. You don't need all the answers to start. You already have the insight, the experience, and the courage that comes from the front lines. Be confident enough to trust your vision and audacious enough to start, even without a map. I did, because our system needs us now more than ever. Thank you so much for having me.